After 60, joint pain becomes a familiar visitor. Stiff knees in the morning, hips that don't move like they used to, fingers that feel swollen or sore. If that sounds familiar, you've probably heard a lot of advice. From neighbors, from the internet, even from well-meaning friends. But here's the truth. Not everything you've heard about joint health is true. And believing the wrong things can actually make the problem worse. Today, we're going to bust some of the biggest myths about joint health after 60 and show you what science actually says, so you can take care of your body with confidence, not confusion. Myth number 1. Joint pain is just a normal part of aging. There's nothing you can do about it. This is probably the most common and the most dangerous myth out there. Yes, it's true that our joints change as we get older. Cartilage thins, synovial fluid dries up, inflammation becomes more common, but pain is not inevitable. In fact, many seniors experience significant relief, even reversal of joint discomfort, through daily movement, better nutrition, hydration, and anti-inflammatory habits. Science shows that joints respond positively to the right kind of care. So don't settle. Don't assume pain is your new normal. There's always something you can do to feel better. Myth number 2. If your joints hurt, you should rest and avoid moving. This one seems logical, but it's misleading. When joints hurt, rest feels like the safest choice. But complete rest often makes joints worse, not better. Why? Because joints need movement to stay lubricated and functional. Think of your joints like a sponge. When you move them, they absorb nutrients and push out waste. When you stop moving, that process slows down, and stiffness builds up. Now, this doesn't mean you should power through sharp pain, but gentle movement, walking, stretching, joint rotations, is often exactly what your joints need to stay alive and pain-free. So instead of avoiding movement, focus on moving smarter, not harder. Myth number 3. Cracking your knuckles will cause arthritis. This one's been around forever. But multiple scientific studies have shown that knuckle cracking does not cause arthritis. It might annoy the people around you, sure, but the sound you hear is just gas bubbles releasing in the joint space, not damage being done. That said, if cracking comes with pain or swelling, it's worth checking in with a doctor. But the act itself? Safe, and mostly harmless. Myth number 4. You should only exercise if you're completely pain-free. If seniors waited for the pain to go away before moving, most would never move at all. The reality is, some discomfort is normal when you're rebuilding strength and flexibility, especially if you've been inactive for a while. The key is to start slow. Use light resistance, stretch gently, and listen to your body, not avoid it. Exercise is not the enemy. In fact, it's one of your biggest allies in managing joint pain and preventing further degeneration. Even a few minutes a day can improve circulation, reduce inflammation, and protect your joints long-term. Myth number 5. Supplements can fix everything. Supplements like collagen, turmeric, and omega-3s can support joint health, but they're not magic. They work best when combined with movement, hydration, and a joint-friendly diet. Think of them as tools in your toolbox, not the whole solution. And always choose high-quality, third-party tested supplements over cheap imitations. Talk to your healthcare provider before starting any new regimen. And remember, consistency is key. No pill works overnight. So what does science actually support when it comes to joint health after 60? Gentle daily movement, even 5 to 10 minutes, can make a huge difference. Anti-inflammatory foods like berries, leafy greens, olive oil, and salmon hydration. Water keeps your joints cushioned. Targeted nutrients like collagen peptides, magnesium, and vitamin D, sleep and stress management, because inflammation doesn't just come from food. When you take care of your body consistently, even in small ways, your joints respond. They may not feel like they did at 25, but they don't have to be your enemy either. You just have to stop listening to bad advice and start listening to your body. If you've heard any of these myths before, now you know what to do. And if this video helped clear things up, give it a like and share it with someone you care about. Because we all deserve to feel better in our bodies, no matter our age. And if you want more tips on aging strong, staying active, and protecting your joints naturally, subscribe to this channel. We're here to walk with you every step of the way.